Funding for more testing, this time for the Vacaville community. A COVID testing site is opening its doors today, giving first responders first priority. KCRA3's Aaron Heft is on site this morning in Vacaville to tell us more about the event today. Aaron, good morning.
Good morning, Leticia. The Vacaville Unified School District getting extra funding from the California Department of Public Health. This to expand hours at their COVID testing site. This all starts today and goes for the next 2 weekends. Opening late last year, this site has been granted extra funding from the state to get more people tested for COVID. They say this is huge for their community, especially among this new surge. That coupled with how difficult they say it's been to get people tested quickly. Today they explained they're giving priority to first responders. This all happening from 10 this morning to 2 this afternoon. It's going to be at 621 South Orchard Avenue in Vacaville. That address is right on your screen right now. The district has made this testing by appointment only, creating an Eventbrite link. Simply search for the Eventbrite site for VUSD Community COVID Testing. This an opportunity for the community that's not employed by Vacaville Unified School District and not a student or family of Vacaville Unified School District to come out today or for the following 2 Saturdays and get tested. The goal is to get this testing done as quickly as possible because people right now, if you're out of work and you need to know if you have COVID right now so you can get back to work, that is the stopgap right now, keeping people out of work and out of the schools. Reporting from Vacaville, Aaron Heft, KCRA 3 News.
Aaron, thank you. The Woodland Joint Unified School District delivered N95 and KN95 masks to staff, teachers, and students this week. Everyone has to wear a mask on campus, but they don't necessarily have to wear one of these. The district says parents can contact their children's school to request one of these high-quality masks. New CDC studies reveal a first-hand look at vaccine effectiveness during the Omicron surge. KCRA3's Christopher Salas is live in our Washington bureau. And Christopher, what are these studies showing?
Leticia, good morning. Well, it really shines a light on booster efficacy. We're talking about 3 new studies from the CDC. The agency looked at millions of cases of COVID-19 across the country. And what these studies showed is that while vaccines are less effective against Omicron than earlier mutations, boosters increase virus fighting antibodies, as what has been long suspected. One of the studies showed that during the recent surge, those boosted had a 90% chance of avoiding hospitalization. In comparison, getting only 2 shots was 57% effective at avoiding hospitalization. Another study showed a 3rd dose gave you an 82% chance of avoiding the ER or urgent care. If you weren't boosted, that dropped to around 32%.
When you get your initial vaccination, for a period of time, you're really good. But as soon as you get down to around 5 months, you need the boost to get you right back up, even better than where you were to begin with.
And the studies also showed that boosters offered good protection against catching Omicron or developing symptoms altogether. Leticia.
And Christopher, what did Dr. Fauci say about vaccines for children under the age of 5?
Yeah, Leticia, so Dr. Fauci said it's really on the FDA's timeline at this point, but he is hopeful that something will get done at the beginning of this year, maybe even within the next couple of months. He said the data shows so far that for kids 6 months to about 2 years old, there is an adequate response to the dosage that they're currently experimenting with. But that wasn't the case for children 2 to 4 years old. So Dr. Fauci said right now what these companies are really trying to figure out is what is the appropriate dosage for those children.
Good to know. And Christopher, the FDA has extended the use of remdesivir, the drug, for mild to moderate COVID cases. Can you tell us a little bit more about that?
Yeah, so previously this treatment was only for people who were hospitalized with severe COVID, and now it's been approved for everyone to use the drug, including those who are not hospitalized, those who test positive for the virus. But it's an important distinction. It has been approved for those who are considered high risk for potentially being hospitalized or suffering severe COVID. So what patients would do is they'll get in a medication that will be administered via an IV, and the treatment can last up to 3 days. Leticia.
Good to know. Christopher Salas, thank you for your report in Washington this morning.